Do you frequently feel like your heart races or your hands shake when someone looks at you? Maybe you avoid speaking in class or hanging out with friends because you're scared of saying something wrong. That's not just shyness, it could be social anxiety disorder, also called social phobia. Imagine being scared every time you walk into a room, not because it's dangerous, but because you think everyone is judging you. That's what people with this disorder go through daily. For example, Sarah, a 17-year-old student, skips group projects because she fears her voice will tremble and others will laugh. She's not lazy, she's struggling with social anxiety. It's more common than you think, affecting millions worldwide. The good news, it's treatable. So what causes social anxiety disorder? It's not just bad parenting or being too sensitive. It's a mix of biology, environment, and life experiences. Think of it like this: if anxiety were a fire, certain things light the match. For some, it's genetics, like if mom or dad also get super anxious in social situations. For others, it's a tough experience, like being bullied at school. For example, Tom was laughed at when he gave a speech in 6th grade. Ever since, he freezes at the thought of speaking up. Brain chemistry also plays a role. Some brains are wired to overreact to social stress, like a smoke detector going off when you're just toasting bread. It's not their fault, it's how their brain responds. How do you know if it's more than just nerves? Signs go beyond butterflies before a test. People with social anxiety often feel intense fear before, during, or after social events. Their heart pounds, they sweat, blush, or even feel dizzy. They might stutter or go silent. They fear being judged, embarrassed, or seen as weird. For example, Jessa avoids eating in the cafeteria because she's scared of spilling food and being laughed at. She even turns down job interviews despite being qualified because talking to strangers feels like climbing a mountain. Kids might cry or throw tantrums to avoid school presentations. These aren't choices, they're symptoms of real fear that feels impossible to control. Diagnosis isn't done with a blood test. A mental health expert, like a psychologist, talks with the person, asking questions like, "Do you get overly nervous when meeting new people?" Or, "How long have these feelings been going on?" To be diagnosed, the fear must last 6 months or more and mess with daily life. The good news, treatment works. The most effective method is CBT, cognitive behavioral therapy. It's like retraining your brain. For example, Maya learns to challenge her thought, "Everyone will laugh if I speak," becomes, "Maybe they won't even notice." Gradually, she practices speaking up in small steps. Medication, like SSRIs, can also help by calming the brain's fear response. Therapy plus support equals real progress. While you can't control genetics, early help makes a big difference. Think of it like brushing teeth to avoid cavities. Parents and teachers can help by encouraging brave behavior, not forcing, but supporting. For instance, instead of letting a child skip a show and tell, encourage them to bring a photo and talk about it, then praise the effort. Building confidence early helps. Teaching kids how to handle criticism. It's okay to make mistakes and practice social skills, like starting conversations, builds emotional strength. Just like learning to ride a bike, social confidence grows with safe, steady practice. Scientists are learning more every day. Recent research shows that virtual reality VR therapy is helping people face fears in a safe space. Imagine wearing goggles and standing in front of a class to practice speaking. No real people, no real judgment. Studies show it reduces anxiety over time. Also, researchers are studying gut health and its connection to anxiety. Yes, your gut and brain talk. Some new apps now offer CBT exercises with chatbot support, making help more accessible. A 2023 study found that teens using these tools showed improvement in just 8 weeks. The future, more personalized, tech-friendly ways to heal, bringing hope to millions.